For the lack of time, we are having one questions per speaker. So for Dr. Esther, the question is, what is the difference between lifestyle medicine and social and preventive medicine? You can come up on the dais. While we're waiting for Esther to come, you can ask.
For Dr. Audrin, for patients with preeclampsia, what postpartum follow-up would you suggest to look for progression to chronic cardiovascular disease?
So according to the guidelines, you need a follow-up 1 week, 6 weeks, and then 3 months, and then yearly follow-up. So if you have had preeclampsia, you need yearly follow-up for cardiovascular risk factors, cholesterol, lipid profile, ECG, and looking for cardiovascular risk factors once a year.
Thank you.
Dr. Soumya, can it be considered PPCM if a patient presents with heart failure symptoms and signs 2 years after delivery with documented reduction in LVEF?
I think when it comes late onset, it's better to rule out all other causes and then take a relevant history, because the PPCM will present itself much earlier. So you'll have to go back and ask during that time, did anything happen? Because there is 1/3 of the population who actually recovers. But classically, they picked up in that period at or post-delivery.
To Dr. Sudha, considering the challenges of fine-tuning large generative AI models in the context of medical education, how do you handle the inherent trade-offs between model generation, generalization, and domain-specific adaptation? It's a very large question, sorry.
I'll probably put that into the GPT. I don't know the answer.
Okay, I'll just repeat it. Considering the challenges of fine-tuning large generative AI models in the context of medical education, how do you handle the inherent trade-offs between model generalization and domain-specific adaptation when working with limited domain-specific data sets?
Okay, let me just simplify that into normal English for you. Okay, what happens is that when you kind of say, okay, get me differential diagnosis from a GPT, it will give you differential diagnosis across PubMed. Okay, whereas if you're in India and you say, okay, fever with thrombocytopenia, hepatitis, the first thing I would think of is probably with body aches and pains. And this season, I would say, okay, dengue, because it rained yesterday or it rained last week, right? So that contextuality doesn't happen. And that's what they're talking about, this domain trade-off. How do you do it? I don't know. But it goes with this human learning. Sorry, it is reinforced learning human feedback, which is basically the feedback that the human gives as it generates. You kind of write back and say, hey, this is not what you think. In South Asia, okay, or in South India, in the rainy season, the more specific you get, the more better your answers are going to get. I think that's probably what I would think, but I don't know this exact answer because I'm not the expert. I'm not a GPT expert. I just know how to use it. I know the pitfalls, the problems with it, and the advantages and where you can use it. So you ask me questions with regard to that, I can help you.
Thank you, ma'am.
Thank you, Sudha. This was only half the question. But it's okay. It's okay. That's okay. That's okay. So there was many more things. It's all in the
Okay,
AI.
I don't mind having a discussion because I think I can learn from you. So catch me outside during tea time.
This may be a chat GPT generated
Question, yeah, it looks
So-
like that.
So, last question to Dr. Ramya. What is the best way to train physicians to be structurally competent?
Actually, I just want to say I'm developing some modules on structural competency. And whoever's interested, please write to me. I'll send it to you. And there is a structural competency working group online, which has modules, but they are from the Westerners. So that is more about interracial and things like that. So anybody who writes to me, please write to me. I will give you the modules for the Indian audience. Thank you.
Thank you, ma'am. Thank you, Dr. Hansrak and Dr. Kripa. I would like to thank the faculty from the Department of Medicine for this very informative session. For all the questions that were not answered, we will answer them and send you the answers via email. We will take a short break and we would like to invite everyone back for the Benjamin Polymer oration.